Postmenopausal bleeding. Postmenopausal bleeding is vaginal bleeding that occurs after menopause. Menopause is when a person assigned female at birth, AFAB, hasn't had a menstrual period in 12 months. Bleeding from your vagina after menopause isn't normal. Symptoms of postmenopausal bleeding: 1. Any small amount of blood. 2. Bleeding that seems to mimic a menstrual period. 3. Blood clots that pass with other bleeding. 4. Heavier flow than what a woman experienced during menstrual periods. 5. Blood that appears after vaginal intercourse. Causes. The most common causes of bleeding or spotting after menopause include: 1. Vaginal atrophy. The lining of your vagina becomes thin and dry, which means it bleeds more easily. 2. Hormone replacement therapy, HRT. Changing or stopping HRT can cause bleeding. 3. Endometrial hyperplasia. The lining of your uterus gets too thick and may contain abnormal cells. 4. Uterine polyps, benign growths in your uterus. Other causes can include: 1. Cervical cancer, cancer on your cervix. 2. Cervicitis, inflammation of your cervix. 3. Bleeding from nearby organs like your bladder or rectum. 4. Injury or trauma to your vagina. Diagnosis and tests. Your healthcare provider may perform all or some of the following tests to determine what's causing your postmenopausal vaginal bleeding. 1. Pelvic exam to check your vagina and cervix. 2. Pap smear to check for irregular cells on your cervix. 3. Transvaginal ultrasound. 4. Endometrial biopsy to collect cells from your uterine lining. Your provider may also ask you questions about when your period ended, what medications you take, or if you have any other health conditions. Management and treatment. How is postmenopausal bleeding treated? Treatment for postmenopausal bleeding depends on its cause. Medication and surgery are the most common treatments. Medications include: 1. Antibiotics. Antibiotics treat most infections. 2. Estrogen. Taking supplemental estrogen helps bleeding due to vaginal atrophy. 2. You can apply estrogen directly to your vagina as a cream, ring or insertable tablet. 2. Systemic estrogen therapy may come as a pill or patch. 2. When estrogen therapy is systemic, it means the hormone travels throughout your body. 3. Progestin. Progestin treats endometrial hyperplasia by triggering your uterus to shed its lining. 3. You may receive progestin as a pill, shot, cream or intrauterine device, IUD. Surgical treatment includes: 1. Hysteroscopy. This procedure allows providers to diagnose and treat causes of uterine bleeding like polyps or growths. 1. Your healthcare provider inserts a hysteroscope, thin, lighted tube, into your vagina to better see the inside of your uterus. 2. Dilation and curettage, D&C. This is a procedure to remove the lining and contents of your uterus. 2. Your healthcare provider may perform a D&C with a hysteroscopy. 2. A D&C can treat some types of endometrial hyperplasia. 3. Hysterectomy. This is a surgery to remove your uterus and cervix. 3. You may need a hysterectomy if you have uterine cancer. 3. Your healthcare provider can tell you about the different approaches to hysterectomy. 4. Saline infusion ultrasound. Also known as sonohysterography, this procedure involves your provider filling your uterus with saline and then using an ultrasound to better see abnormalities inside your uterus.